Hello, and welcome to the Adult Alliance Innovative Outreach to Encourage Adult Immunizations Learning event. I am Rebel McKnight, the Immunization Task Manager for the Adult Alliance. In this presentation, we are showcasing innovative vaccination events held in the states of Alabama, Indiana, Kentucky, and Mississippi. In our first interview, Wendy Looney, the Director of Nursing at the College of Community Health Services at the University of Alabama, will be discussing their Flu Blast campaign.
Our influenza vaccine campaign is titled Flu Blast. It's been going on for many years, at least 8 or 9 years. It becomes more successful every year. This past campaign, the 17-18 campaign, we gave almost 9,000 influenza shots on campus, which is huge. Our Flu Blast begins right after Labor Day, and it goes through mid-November. We schedule multiple locations on multiple days at multiple different times to try to make it as convenient as we can for people to stop by and get their flu shot. When we go to the multiple locations, we usually set up a tent. It's supplied throughout the day, back and forth between our purchasing department. We take nursing students, we take nurses to give the immunizations. We have administrative staff there to help with the flow. We have a sign-up table where you actually sign your consent and then you move on to the next table to get your injection. It's really quick, just takes a few moments. We have everyone that's working the booth is wearing their flu shot T-shirt, and of course we give out free candy as well. Lots of reasons to stop by. The influenza vaccine is offered free of charge, and it's offered to employees, students of the university, and the employee's spouse, and also retirees of the university. And that is paid for through our financial affairs department here at the university. This effort is a collaborative effort among the University Medical Center, the Community Health Sciences, in partnership with the University School of Nursing or Capstone College of Nursing, and also the Student Health Center here at the university. And our Wellbama, it's a program here that sponsors lots of events to promote wellness on our campus, so that's our Wellbama. So it's a big collaborative effort between all of those entities here on our campus. We do a lot of advertising so that everyone knows where we're going to be and what time we're going to be there. I would have to say that without our marketing and communications department, this would not be a successful campaign. They do a great job communicating out the dates, the places, what you need to do. They do news releases. They make sure that it's on the news. They use social media. One of the biggest things that I think gets a lot of buy-in, as there's a lot of excitement around, is each year we have a flu shot campaign T-shirt. And so the T-shirt is unique and a new design each year, so it's always fun to see, what the new design is going to be. And then all those entities I named earlier get T-shirts to wear around, as walking advertisement on campus. That's a big deal. Everybody loves their T-shirt.
What are some lessons learned about community outreach, health fairs, that you want to share?
One of the lessons learned was to be in strategic locations to be able to service as many people as possible, which is led into setting up tents out in the areas where people are most likely to be walking. One of the lessons that's been learned is that there is still a lot of miscommunication about flu vaccines, so we do use this time to educate people about the flu vaccine and about the reasons to get the flu vaccine. Another lesson learned is making sure that you have enough supplies on hand. So we have big plastic bins that we take the supplies in. So each person who's providing injections gets their own personal box of supplies. That's our purchasing department who is instrumental in making this go well. We never have to stop the flow of the event to restock. We did create a database so that when we come back each day, we did learn that it was when you're out doing these events, the documentation is crucial. And so they have learned how to come back each day and put those names in a database. And then we do double check the documentation to make sure that we've gotten everything documented. We found out our communications department is responsible for, they had a brilliant idea. And so there's a Student Health Center parent group email list, and they send the dates of the flu shots via email to that parent group email list. And we have heard from several students that stopped by that they came because their parent talked to them about the flu shot and asked them to come by. And we do have written processes, and then our next step is to improve those even more. In the past, I think there's been times where there wasn't enough vaccine. So one thing that we do is we pre-book and we order large shipments up front so that we hopefully get all of our order filled. We have seen increased demand, so we have to be very careful about that upfront ordering. Another lesson learned is staffing this event. We were pulling staff from our clinics to go out and staff the event, which would usually negatively impact the clinic because of the staff being low on the day that we were doing the flu blast. We've actually started to hire PRN staff just to do flu shot during that season. We use university nursing students, and so we have learned that you really have to book with them early before they start booking their clinical sites to make sure that our flu blast event dates, that they're able to be there as well on as many dates as possible.
What are barriers that have been encountered when planning prior health fairs, and how did you address them to ensure your event's success?
Some of the barriers have just been growth. As you grow, you've got to increase the number of staff available to run the campaign, continuing that excitement and buy-in for the campaign as you go over time, trying to think of new and exciting ways to roll the campaign out each year, having our supplies on hand, being overly organized. I don't think we can be too organized to pull off a campaign like this where you're, administering anywhere between 7,000 and 9,000 vaccines. We start planning early, so that was something we found is key, is to start planning early. We actually have a team that meets to even plan the planning meetings. We do offer the high-dose vaccine as well as a part of our campaign, but we do give that here internally in our faculty staff clinics. We tried, I think, in the past to maybe do different type of doses, but for safety and for convenience and to make sure that we don't have any errors, we try to keep everything streamlined, and we address that by having that vaccine actually given here within the clinic. There are some other opportunities for us to educate our university community, and so we use every possible avenue to educate about the flu shot on top of just our campaign. So I know that our marketing department works here with the university to get articles put in the paper. I was invited to address the community through a program that we call Mini Med School on the topic of flu shots and influenza and the dangers related to flu. So we really have taken ownership of successful influenza vaccine in our community by educating and keeping it as a part of our focus throughout the year. Last year, our new university president, Dr. Stuart Bell, came in and allowed us to take pictures of him getting the first flu shot, and so that was used as part of our advertising and campaign, and he made every effort to talk about the flu shot and encourage the faculty and staff and students to come by and get their flu shot. By having everyone involved and everyone getting behind the campaign, that is really part of the secret to our success.
In the second interview, David Pavey the infection prevention nurse at Decatur County Memorial Hospital in Indiana will discuss their drive-through flu shot clinic event.
What made your event so successful?
Our public influenza program is funded through a 340B drug pricing program. It is a program that gives reimbursement for high-need areas for drug coverage. And because of this, some of that money needs to go back to the community, and we try to give as much back to the community as we can. The public in general has wanted influenza coverage, and because of that, we provide it through this program. We also have a hospital foundation that helps. Because of doing it through the hospital foundation and the 340B drug program, it takes away a lot of the budget restrictions that we may have had otherwise. And because the budget restrictions are gone, we are able to provide more staff to these events. Providing more staff actually increases the numbers. Providing the shorter lines makes people look at it and say, I think right now is a good time to get it. We offer numerous sites and times for these events. Some of them have been walk-in. The ones we're most known for around here is the drive-through clinics, and that's where people remain in their car. They're given paperwork, they fill it out on the way up, and when they get to the end of the line, we can vaccinate whoever's in the car. Elderly people, they don't have to get out, they don't have to walk in. Also good for handicapped, pregnant women. It starts alleviating excuses for not getting the flu vaccine, especially in those people who are at higher risk. Providing different sites and different times also helps with the community in general because you have different factories that get out at different times. You have people who get out of work at different times. Kids may not be able to make it to one through the day, but they will be able to make it to one in the evening with their parents. I think more than anything what makes our event successful now is it's an annual event. It's been an annual event for several years now, and the public is just coming to expect it, which is great. They kind of wait around and see when our times are going to be, and then they will plan accordingly to make sure they get in and get their influenza vaccine.
What are some lessons learned about community outreach, health fairs, that you want to share?
Some of the lessons we've learned through doing these events annually is, probably most importantly, is keep everything from year to year. I know that sounds silly, and some people may think, well, this didn't work for us this year, but we keep everything. I just keep it all in my office, and when we go to plan for the next year, we can pull that out. So not only does it help me plan for mine, but some of the other sites, when they have theirs, something that didn't work for me may work for them in the future. So keeping all that to reflect back on is very beneficial. Fliers, we found Fliers in the past that prevents us from having to go through the whole process of reinventing that when we can just implement it and go. Other research that we've done in the past, like I said, even if it's something that we did not use or utilize one time around, it's something we may try to implement another time because it may speed up the process. I think that's the lesson you need to learn for each time is how to speed up the process, how to make it less cumbersome. If you can develop a form that takes a little less time than another form, once again, you're decreasing your line. And if you're decreasing your line, you're increasing the number of people that you have coming through that line. And if you're increasing that number, then you have more people with influenza coverage. Another lesson is to have a debriefing afterwards with the responsible people involved. Have an open forum, and everybody just kind of discusses what they've seen that went well this time around, what they've seen that went wrong, and any improvements that they've seen that may help in next year's. Make notes of that, throw it in with the other stuff that you're keeping from year to year, and reflect back on that before you do the next one. If you did have any problems, if there were any problems addressed or people noticed, make a plan to correct those. And start on it fairly early, while it's still fresh in your mind, while you still remember why it was a problem, and develop a plan what you're going to do the next year to alleviate that problem. For us, probably the biggest lesson learned is we need a lot of people from our organization to be involved in this. We have people from the immunization clinic because they're used to doing large-scale immunization programs. Infection prevention, pharmacy, we need to make sure that we have stock in. We need to make sure that stock is not going to be an issue. And the timing is good on them. Nothing's worse than scheduling a flu clinic like this, expecting several hundred people, and not being sure if you're going to have enough supply to supply all those. So keeping them in the loop. Marketing, as far as getting your message out, the sooner you can do that, the sooner people can kind of plan when they're going to get their flu shots. We use EMS. The hospital foundation provides us with volunteers for helping control traffic and collecting clipboards. Maintenance helps us by picking up barriers and that from the street department, setting up our little course for the cars to get through to get back to the end of the line. Purchasing, making sure we have the syringes, the alcohol pads, the Band-Aids, all that we need to make sure we have in place. And, of course, finally, administration. We need to have administration on board to really see a benefit in getting these out to the community. I feel very fortunate at the hospital that I'm at that our administration has made a huge push here recently to have a lot of community involvement, and this is something the community likes to have, so it just kind of goes hand in hand. And then lastly, volunteers from across the hospital setting. At these events, I've had people from doctors' offices come out and help give vaccines. Surgery department. I've had OB and med-surg in the past. It's one of those that it's become so popular now that I sometimes have to turn volunteers away just because we have more than enough volunteering already.
What are barriers that have been encountered when planning prior health fairs, and how did you address them to ensure your event's success?
Some of the barriers we encountered and how we corrected those, probably the biggest barrier, especially with the drive-thrus, is traffic. Anybody who's planning an event like this, traffic is going to be a huge concern. Even if you're planning a walk-in clinic, traffic or parking can be a concern. So looking at that ahead of time and realizing how much space some of these vehicles take up is a big thing. The last thing you want is for the public emergency system having to get involved because you can't keep the road clear. We also have EMS help us with traffic control. Street department, the local street department, we borrow cones and barriers from them. Maintenance sets those up for me. We moved where we initially hand off the paperwork into more of the middle of the collection area. So we would have numerous cars before they ever got paperwork. And with that, another correction we made is don't stop the movement of people. With a drive-through clinic in particular, we were handing clipboards out with forms and having them fill them out and then hand them back to us at the time. Well, then you only have one or two people who are filling out forms at a time. How we have done it in the past couple years is we will hand out forms on a clipboard for everybody in the vehicle and send them on their way. And the people in the vehicle can be filling them out as they're continuing their route forward. And then we have volunteers that are halfway between us and where the clipboards are handed out, and they'll bring the clipboards back once they're done writing on it. But that just allows the movement of traffic to keep going. Once again, if you keep that traffic moving, the line looks a lot smaller, and more people are willing to jump in there and get their flu shot done. Another thing that we have had to correct for, or a problem we have encountered, is bad weather. These things go great when it's a 65-degree day and it's sunny out. But we've also had it where it's cold and it's windy and it's raining. Cold, of course, can slow things down because people, when it's cold outside, they'll dress warmer. So they're putting on a T-shirt and a sweatshirt and making it a little more time-consuming to actually give the injection. So with that, we will a lot of times take an additional volunteer and move them towards the end of the line where they can tell people you're going to be coming up next, so go ahead and get your arm ready. That kind of speeds things up. Wind can cause probably the most havoc because it just blows everything around. This last year we had some high winds, and we would have paperwork that'd want to take off. We would have Band-Aids or the strips that come off of Band-Aids. Those are notorious for flying away. So having, for us, what we learned there is have a good covered trash can where you can drop it in and it's collected there. Otherwise, people will be driving up and the place will kind of look like a disaster with all the paper blowing around. So having the covered trash cans as well as the paperweights to just hold paperwork down is a huge benefit. And then rain can make these type of events miserable. Nobody wants to stand out in the rain giving vaccines. We are fortunate enough, and a lot of facilities like us have the same option of buildings with awnings. There is a doctor's office that is right behind the hospital, so they will come in beside the hospital and weave back and forth until they get to the back building. And we can have our volunteers underneath that awning giving vaccines as they come through. That keeps them out of the rain. If somebody is preparing for one of these events and they don't have that option, if they don't have that luxury, the pop-up canopies, they work great. You can hold your vaccine, keep everything dry, and keep your people happy. That way they're more likely to volunteer again next year.
The third interview will showcase the Institute for Rural Health at Western Kentucky University. Tammy Geltmaker of the Adam Alliance will be discussing their mobile vaccination unit.
Hello, I'm Tammy Geltmaker, Kentucky Quality Program Director for Adam Alliance. I'm speaking to you today on behalf of Dr. Matthew Hunt, Director for the Institute for Rural Health. I will be highlighting an innovative strategy being used in Kentucky to promote immunizations in rural settings. I'd like to first begin by sharing a little bit about the Institute for Rural Health. Institute for Rural Health is a vital part of the College of Health and Human Services and Western Kentucky University. IRH was created to identify rural health and human services needs and to facilitate collaborative arrangements that engaged Western Kentucky University students and faculty with community agencies for the purpose of addressing the needs of the communities within the 27 county service area. The goals of IRH are to facilitate in the education of future health professionals by engaging Western Kentucky University students in service learning and multidisciplinary activities, exposing them to a diverse patient population. Another goal of IRH is to improve the health and wellness status of residents of Western Kentucky University's regional service area by providing health screenings such as blood pressure, bone density, body mass index, cholesterol and diabetes, immunizations, and oral health services at selected locations. The IRH primarily offers services in the Barren River Area Development District, a service area that is predominantly rural and home to more than 284,000 people. However, there are some additional counties outside of that district where services are provided also. Serving as a clinical rotation for the School of Nursing and Dental Hygiene programs, IRH not only provides students with the ability to apply their knowledge and skills gained in the classroom, but also access for rural populations to health education, screenings, immunizations, and services through the use of 2 mobile dental and mobile health and wellness units. According to the Institute for Rural Health's 2014-2016 biennial report, these units provided students with over 8,194 hours of real-world experiences in a rural setting during that 2-year time frame. Approximately 16,439 dental and medical procedures, which included vaccinations, were performed on over 8,700 patients. The number of influenza vaccinations given through the mobile health unit has steadily increased each year. For example, the 2012-2013 flu season, they were able to vaccinate approximately 1,295 people. This number reached 1,727 in the 2016-2017 season. The use of the mobile health units have played a critical role in assisting the College of Health and Human Services with facilitating successful student engagement and providing a valuable service to members of the community. Adam Alliance looks forward to exploring opportunities for collaborating with the Institute for Rural Health and Western Kentucky University during the upcoming flu season, assisting in their efforts to emphasize the importance of preventive care and provide overall health education to individuals across South Central Kentucky.
In our final interview, Mary Catherine Kite, the Public Relations Manager from OCH Regional Medical Center in Mississippi, will discuss their Baby Boomer Senior Expo event.
What made your event so successful?
Well, I feel what made this event so successful was the fact that we partnered with so many different entities. We had 3 major health systems partner with us to offer a wide variety of programs and services that seniors in our community can benefit from. So we partnered with UMC, University of Mississippi Medical Center out of Jackson. Their Mind Center came, so that's dealing with dementia and Alzheimer's, which we all know, affects our aging population. So they came. North Mississippi Medical Center, their Spine Center came. That's something that we don't have here in our community, the access to the Spine Center and Retina Center. They came. And then also Baptist Memorial Hospital, which is a part of Baptist Health Systems, they came from Columbus, just a few miles down the road, and they brought information and professionals with their behavioral health, cancer center, and then their hospice care. So what we did was just reach out to our surrounding communities, different health systems right here in our state. We could utilize them for support and give the attendees to the health fair better information and provide them access to care that they may need that's not right here at home. So I think that was one reason why it was beneficial. We also made it more of a fun day. We offered bingo and prizes and food, and I think anytime you offer that, especially to seniors who are retired and maybe don't have a lot to do, that I think that played a big role in it too, getting people out there to the event.
What are some lessons learned about community outreach, health fairs, that you want to share?
What I've learned from this is that we all have to work together. Yes, we may be separate entities, but we're all working toward the same goal, and that's providing the very best care for all the patients here in our community, our region, our state. And so including other health systems, they were more than happy to come and bring their resources and knowledge to help these seniors in our community. I think if I would have had it earlier in the morning, maybe there would have been more people. We started it at 10 o'clock and went 10 to 2 because this was done in the past. But I think earlier would have honestly been better. I think that getting the word out as soon as possible when you're planning an event, if you're having a health fair, the sooner you can get the information out about your health fair, your community outreach program, the better. We all really need to work together, especially in today's healthcare system when budgets are being cut, with reimbursement not being like it used to be. We still have to keep that focus on patient care, and so we can do that if we can all pull together, and maybe we don't work on the same team, but we can all work together as a team.
What are barriers that have been encountered when planning prior health fairs, and how did you address them to ensure your event's success?
I think anytime you're planning a health fair, any community outreach that involves a larger scale and dealing with several different entities, inviting people from several communities, you're going to run into barriers such as people saying, well, I never heard about this, I didn't hear about this, and just the communication with your vendors and making sure that people are getting your email and they understand when they need to be there, when they need to be set up, making sure you get the word out. So we utilized TV, ran a spot for us for free, actually, and so that was great. If you can try to partner with a local radio, television, newspaper to put PSAs out there so that it's free. Still putting it on social media, TV, radio, newspaper, putting flyers out. There's still going to be some people who just don't hear about it. And so I'm really not sure what the answer is with that, other than what I said earlier about making sure you get the word out. By that, I would say, a month in advance would be good. I think we did 2 to 3 weeks ahead of time, but a month or even 6 weeks, just to put something out there. And I also visited assisted living centers and gave them flyers and invited them to bring their residents to come. The barrier is just all of the details and making sure you have all your I's dotted and T's crossed. That can be very overwhelming and challenging to make sure that you've done everything possible to make this a success. One barrier people might face is just the financial aspect of putting something like this on, and I think that's when you have to ask, as we did, our Sportsplex here, can we have a discount on this facility? And then go to your local media and ask them, will you run a PSA for us, or write a press release that's ready to go to the paper, and they really don't have to do anything to it. They'll put it in there. That gets the word out, and that's free advertisement. So I think, finances might be a barrier, and by doing just some of the things by asking, it doesn't hurt to ask, you can get a discount, or sometimes they'll do things for free.
Thank you for joining us to share in the success of these 4 facilities. Please reach out to your State Alliance advisor for assistance in becoming a champion to increase adult vaccinations, specifically influenza and pneumococcal. Thank you.